Hello, I'm Dr. Patrick Torkson. I'm the Chief Medical Officer here at St. Tammany Health System and its flagship 281-bed full-service community hospital here on the North Shore of Lake Pontchartrain. I want to take this opportunity and congratulate you on your professional achievements to date and really appreciate that you're taking the time to evaluate our organization as a professional opportunity. St. Tammany Health System was founded back in 1954 as a community hospital here to serve this very special and unique community here on the North Shore. And since then, we've grown into a regional leader in innovation and technology as a physician-led healthcare provider in the community. Not only is St. Tammany a very special place to practice, it's also a very unique and special community to live. The proximity to New Orleans here on the North Shore of Lake Pontchartrain provides for a very family-friendly environment, and it's a great place not only to practice but to raise a family. But don't just take my word for it.
So I chose St. Tammany Health System as my professional home because of the environment here. I saw that people loved working here, that there was good communication with administration. It was a very welcoming environment where high quality care is done.
So since 1996, North Lake Pulmonary has been in the community. And then around 2005, we were working out of 4 different hospitals in 2 different parishes. And it was really too much for us as a group. And so at that point, we decided we need to scale back where we would go. And over time, over years, we eventually left the other hospitals and for several years have solely been at St. Tammany Parish Hospital.
So I had the unique opportunity of actually receiving health care from St. Tammany myself growing up, so I knew what kind of quality care that St. Tammany provides, and that just really made me want to join a system so I can provide my own patients with quality care.
In 2003, we were employed by East Jefferson. They separated with us in Washington Parish. St. Tammany approached us for a relationship. We embarked on an employment agreement with them and been with them since that time, almost 18 years now.
And I always enjoyed doing hospital medicine work, so when the hospital medicine program started here back in 2005, 2006, I joined soon after that. And now I've been here for the past 16 years as a hospital medicine physician here at St. Tammany.
So St. Tammany Parish is the #1 place to live and rear a family in the state of Louisiana, statistically and otherwise.
I lived in several other states over the past 10 years, and as my children grew and we wanted to move close to family, St. Tammany was an easy choice because of the safety, the schools. It's just a wonderful place to live and be.
Number one, the food is great. Everybody hears about New Orleans food, but you don't have to go to New Orleans for great food there. It's very family oriented. There's plenty of places to go.
There's nowhere else like it. Between the rich culture, the food, the people that are just amazing, I just can't imagine myself living anywhere else.
It's been a great place to actually live and raise a family, and been very well supported by the hospital and the community.
St. Tammany Health System is such a special place. It really has a true family feel. Everybody works well together. I say it's physician driven, but it goes throughout every single employee in St. Tammany.
I think it's a culture of teamwork. I think it's a culture of sincerity in St. Tammany. And I think that sets it apart. And I think that with that and the physician driving the healthcare, the delivery of healthcare makes it different than anything I encounter in Southeast Louisiana.
We just have this comfortable feeling home. I mean, because administration, I think, has been really pro-physician. The nursing personnel have been great. The patient population here is very appreciative.
There have been many generations that have received their health care here, and this is a community that trusts this healthcare system, and that's why people and patients continue to receive their health care from us, because they trust us to take care of them.
You know, of course, we know there's a lot of things involved with running the hospital and health system, but it always comes down to what's best for the patient and patient care. Involved with board meetings, or it could be performance committee meetings. To me, that's so very enticing as a physician, because that's what we're here for. We're here to take care of patients, knowing the administration actually has that same vision and do what's best for patients. It really makes everything else align for patient care here at our health system.
There have been some very trying times in 18 years, and the consistency has been their support, irrespective of the people in positions. They have been with us through thick and thin in some pretty difficult times, and that says a lot about the culture of the hospital and the system.
Oh, it's our practice specifically as far as how they helped us. We're pulmonary critical care, and we're front line for the COVID. We needed help, so they were coming up with ways to help us out with more support staff, critical care nurse practitioners. They really stepped up to the plate as far as doing whatever they can.
So when I interviewed with St. Tammany and came on board, I went around to multiple different clinics and throughout the hospital, and I met multiple staff members and physicians that have been here for 10, 20 plus years. They seem generally happy. The fact that people choose to stay at St. Tammany says a lot about the environment and the focus on well-being.
I would talk to physicians that are on staff here, but what would really make a difference is meet the administration. Talk to Joan Kaufman, Pat Torkson's our CMO. They would be glad to talk to you, and you would realize how strong this administration is and how physician-centered they are.
So what I'm looking for in a colleague is someone that's a team player and that will work together with other colleagues as far as bettering the community and bettering the health of the community.
Someone who is trustworthy, kind, I would say somebody that enjoys what they do, because here at St. Tammany we all really do truly enjoy our jobs.
Someone who enjoys physician camaraderie, who bounces cases off the other doctors. We did that all the time, and we cover for each other, we swap vacation time, so if you're part of the team, it makes a big difference.
Some advice when I first started was, do not be afraid to talk to administration or talk to your colleagues if you have a concern, to bring it up. And I felt like that has been very easy. It's very personable, and I feel like my voice is heard here.
What does St. Tammany bring to the table that others don't? And I would ask about the physicians, the accessibility of subspecialty care for patients or primary care for patients. I would ask about the happiness and ask what St. Tammany is doing to make this a better place for physician practice in the realm of wellness and work-life balance. And I think you'd be pleased with the answer.
To be successful at St. Tammany, I would say you really have a good basis. We have good relationships, not only within primary care physicians, but also with our specialty clinics. I know that at any point I'm able to reach out, talk with a specialist, get feedback, I say, and it really provides a stable relationship for you to provide medical care, and also one where you can confidently provide medical care to your patients.
I think having that support, especially for a young physician, is very crucial. Having that support with older senior colleagues in addition. And I think that's, to me, very enticing. It's a very well-established group, and we continue to grow as a hospital medicine group.
Come visit us. Come here, walk around the facility. We have phenomenal facilities. I'm in the new ICU right now, which is phenomenal. Just come visit, come talk to people, and you'll see why we stay here.
Consider your options very carefully. Choose a place where you feel that you can put down roots, a place that you can call home, a place that you can see yourself practicing for years to come.
Look at the culture. Look at the culture from a governance standpoint all the way down to, from a physician standpoint. Talk to people. Get your questions answered. And I think the answers will be St. Tammany Health System.